people have suspected that Epstein-Barr virus, EBV, has been a risk for MS for a long time. And there have been important development recently indicating that that's even more likely to be the case. And so we've been looking at that and thinking about genetic susceptibility and environmental exposures in childhood, because it could be that there is an overexuberant immune response to EBV in people who will go on to get multiple sclerosis anyway. So what we did a sibling comparison study using Swedish register data. And now if you compare siblings to each other, one may have had infectious mononucleosis, which is caused by EBV, otherwise known as glandular fever or kissing disease, and the other hasn't. We can adjust for childhood circumstances automatically. It takes that both children grew up in the same household. They may not have had identical exposures, but they will be similar. And a high proportion of their genotype is shared between them. Not 100%, it's not like a monozygotic twin comparison, but it does tell you about shared or non-shared susceptibility. And what we saw is infectious mononucleosis, this more severe form of EBV infection, is associated with a greater risk of multiple sclerosis. And we see a pattern that we've seen before with other exposures. There is a lower risk in childhood before age 10, and then increased risk between 11 and 20, and then that risk recedes again in later adulthood. So adolescence seems to be a particularly important time when children or young adults are susceptible to some exposures, not just infections. Even work we did years ago on concussion shows that concussion in adolescence raises the risk of future MS, but exposures in earlier childhood don't. So adolescence and possibly beyond, the evidence from EBV indicates it is particularly during adolescence. And then there's a long wait. And this is an important thing to consider when we're looking at risks. There is a long period of asymptomatic or prodromal MS. So you may have your infection when you're 13, 14, 15, but you're not necessarily diagnosed till you're 25, 35, 40. So 5 to 10 years plus between exposure and outcome, which makes it rather difficult to look at more recent infections because we're going to have to wait 10 years to see what the consequences are of some of them in terms of multiple sclerosis. So EBV seems to be an important risk factor, and exposure pattern seems to be important. We're all exposed to EBV virtually, but the more severe manifestation that requires hospital treatment, well, that seems to be a risk, and so EBV is a more important risk factors. But other infections seem to be important too. And again, it's more severe infections. Hospital-treated infections appear to be important. Respiratory infections that require hospital treatment, we see a 51% increased risk of future MS. And again, this is infections in adolescence and MS 5, 10, 15 years later, typically. Infections directly to the central nervous system represent a particularly higher magnitude increased risk. But not all infections are a risk. Gastrointestinal infections don't seem to be associated with MS risk. In skin infections, really, it's completely null. No association at all. Both bacterial and viral infections in adolescents both seem to represent a raised risk. And these associations aren't explained by being secondary to infectious mononucleosis. If we exclude people who had infectious mononucleosis, we see the same pattern of association. So it seems some infections are a risk, but not others. And I suspect that's because not all infections have access to the central nervous system. And so even a respiratory infection, because of the bronchus-associated lymphoid tissue that's seen in adolescent lungs, that can license T cells to cross the blood-brain barrier, therefore creating a pro-inflammatory environment in the central nervous system, possibly triggering that autoimmune demyelination that's seen in MS. Of course, history helps to decide and think, could this be MS? If somebody has had something that affects the central nervous system in adolescence, particularly, that should be taken into account in the history and say, well, this could be MS. Let's look at this. It also says that one of the most important infections that you can have and one of the most important risk factors in general is a severe Epstein-Barr virus infection. So should we be talking about immunization, protection against EBV, because that might eliminate a high proportion of MS cases? Perhaps not all, but I think it would make a significant dent in it.